Brett. All right, well, let's give Brett a minute here. Okay. Okay, well, thanks guys for hopping on the call with us today for our weekly update call. Just like in the past, I'll go ahead and start with some data numbers, and Jordan Powell, our epidemiologist, is on, so I'll allow her to kind of share that data with everybody. And then I'll got a couple other things to share with folks, and then we'll kind of open it up for questions that you have. So, Jordan, if you're ready, I'll go ahead and let you provide the numbers.
All right, thanks, Kevin. So our total number of jurisdiction-wide cases as of yesterday at 3 p.m. was 4,746. This is a 25.19% increase in cases over the past week, so Monday to Monday. Over that time period, cases have been identified from school exposures, including K-12 schools, daycares, and colleges, household and other non-household family exposures, care facility workers and residents, healthcare workers, those who were in attendance of social gatherings, community contacts, and other worksite exposures. The cases by county as of yesterday are Crawford with 221, Kalkaska had 236, Lake 129, Manistee 230, Mason 414, Mecosta 910, and the Ferris State University dashboard reporting 428 cases. Missaukee County had 186 cases, Newaygo 1,140, Oceana 9, and Wexford 371. In the past week, Monday to Monday, there were 16 deaths. 5 of those were associated with a care facility outbreak, and 211 people have recovered. Last week, someone had asked the question of how many close contacts become positive cases. There's really no cut and clear way to answer that question, because those who are listed as a close contact in someone's case and then become a case themselves do have a certain code associated with them, but that code could change based on if that person can be included as part of an outbreak code. So what I did was pull the cases and saw if someone was a household contact or known community contact to another positive COVID-19 case, and of all of our cases, about 33% are labeled as being household or community contacts. So I know that wasn't your exact question, whoever had asked that last week, but hopefully it helps give some perspective in regard to contacts. And that's all I have.
Okay. All right, thanks, Jordan. We'll go ahead and do questions. If people have questions on data, we'll just do all the questions at the end if everybody is okay with that. Okay. Well, as Jordan said, it was a busy weekend. And I don't know if you covered from the total number of cases from 3 p.m. Friday to 3 p.m. on Monday, but that was 413 new cases that we saw in that time frame, and those 9 deaths. I know I had enough death notice calls this weekend to last a lifetime. So, you know, moving forward, we do know that on Sunday night, the governor did speak in referencing a new epidemic order that was put out by MDHHS. Health officers were made aware of this in a 4:30 call on Sunday afternoon. None of this, you know, not much in the way of specifics was provided to us, other than a heads up that this call was going to happen, and that this was some of the areas that it was going to focus in on. So, you know, while not as sweeping as previous executive orders, you know, this epidemic order is it's time limited. It's a 3-week order. It's targeting those areas that we are seeing gatherings and get-togethers and parties that are causing the largest increase in cases that we're having. And so hopefully at the end of the 3 weeks, we'll see some positive signs, but time is gonna tell as to whether or not that's going to happen. Our concern continues to be the healthcare system that continues to be taxed by this increase in cases that we're seeing. Again, as I mentioned last week, our healthcare systems locally are running anywhere from 80 to 100% capacity in their ICU beds. And if they have beds, they don't have staff necessarily to staff those beds or support those beds. So that is a huge issue because the potential is there that if somebody gets sick and needs a hospital bed, they may not have one. And so it's imperative upon all of us to kind of heed the advice that's in the executive order and the advice and guidance that we've been providing since this started, that wear your masks or facial coverings, proper hygiene, wash your hands, cover your coughs, to not attend large gatherings or get-togethers, and try to maintain social distancing. Hopefully by doing this, like I said, we will see some reduction in numbers. As far as a potential light at the end of the tunnel, we continue to hear things about the COVID vaccine. We do know that most likely there will be 2 vaccines that'll be coming out. The Pfizer vaccine has reported that they are showing a 90% effectiveness. I believe the Moderna vaccine was the most recent one. They're anticipated to be about 2 weeks behind the Pfizer vaccine. They're saying they're about 90, I think it's 95% effective. So if that is true, then that there's quite a bit of promise behind that. The issue will be in the time that it's going to take us to get everybody vaccinated, and will individuals take advantage of the vaccine? I think that is something that we'll kind of have to see what is going to happen with that. We're still hearing now the expectation is that vaccine may be available with the 1st or 2nd week of December. That vaccine will be prioritized. The numbers that I'm hearing, and I just got off a call before this one where vaccine and that was being discussed. Right now, the estimation is that initially Michigan is probably only going to get about 300,000 doses of vaccine, and potentially, half of that would be held back to provide the second shot to individuals. So possibly, we'd be looking at having be able to vaccinate 150,000 individuals. Now, there's also discussion that no, we can use that entire 300,000 doses, and then shortly after that, another shipment will be coming. We'll be kind of waiting to see what is going to happen. Guidance and direction for providing this vaccine is going to be coming from CDC. And so we're kind of waiting to see what they are going to provide. On the call that I was just on, they did indicate that there is supposed to be a meeting where vaccination and vaccine is going to be discussed on Monday. I'm not sure if anything is going to come out of that at this point, but possibly there will be additional new information on vaccine next week sometime. Other than that, we'll kind of have to wait and see what is going to happen. Internally, I know we have been talking about vaccine and the process and the protocol that we'll be using. The priority groups will be dictated to us by CDC and the feds in terms of who will be that priority group, who will be that tier 1A group, and who will be that tier 1B group. Depending upon who you talk to, you hear different individuals being included in that group. So rather than put anything out there that is going to be untrue, I'll just not share anything other than it will most likely involve healthcare workers, and how specific we don't know yet, and then that vulnerable population will be in that initial group. So that's what I know on vaccine. We do continue to provide our flu clinics in the community. we are also exploring the possibility of doing some additional pop-up testing sites in the community. I'm not sure how successful we may be with those, but we are exploring it based on requests from individual communities to look at hosting these. So, we have had at least one, possibly two communities reach out to us about doing this. And so we are exploring the possibility of doing that. If we do those, best bet is they would probably take place in early December sometime. So we are looking and exploring indoor locations to do those. And so that is kind of what I have for an update on my end. Brett, I don't know if there's anything that you would like to share from any of the communications or meetings that you may have been in related to emergency preparedness.
No, I think you covered most of it.
Okay. Jordan, anything else from the data aspect that you would like to provide to individuals?
Nothing that I can think of at this time.
Okay. Then Brett, if you're willing to help again with questions, why don't we kind of open it up for questions and see what folks may have.
Okay, it might be easy because right now there are no questions in the chat box. So let me just do another reminder that just so we don't have folks talking over each other, if you have a question, go ahead and type it out in the chat box, and then I'll read it for Kevin and he'll answer the question. And while we're waiting for those on Teams, if there are any questions, why don't we talk to the group that is just on by phone. So if you just called in, you're not on your computer, and you have a question, go ahead and unmute yourself and you can ask your question, and then we'll see if any other people type in a question. So anybody on the phone?
This is Robin Cross from the correctional facility here in Baldwin.
Okay, go ahead.
Can you hear me? I'm the health services administrator here. And I just have a question. We don't have any inmates with COVID yet, but we do have a couple staff members. And so far, so good that it hasn't transmitted across the barriers there. My question is, are you guys noticing less symptoms? I mean, it seems like when we get a positive case, they only have symptoms for about 2 days. Now, these are people that have not been tested in the past, so they're brand new positives, but I'm just noticing, at least here, people don't seem to be as sick with this go around. Maybe it's just, maybe what I'm looking for is subjective versus fact, but that's what I'm seeing here.
Yeah, I don't know, Jordan, if we've got any concrete data, probably more subjective that we would have.
Yeah, I'm not really sure about duration of symptoms. We do try to collect what type of symptoms people are having, which oftentimes includes, fatigue, which could be a general symptom for a lot of things. But as far as duration goes, I don't think we have anything concrete around that.
And I think, Robin, also, and again, I'll let Jordan correct me if I'm wrong here, but based on, excuse me, the cases that get escalated back to us and the information that we're seeing, the vast majority of those individuals are having, some type of symptoms, and, probably to a greater percentage than those that are ending up asymptomatic. Is that correct, Jordan?
Yeah, it does seem like most people are experiencing symptoms that we talk to at this time, whether it be, like you said, Robin, for 2 days or longer than that. At some point during their course of illness, it does seem like they're experiencing symptom.
Okay, I've got a couple questions in the chat box, so we can come back to the phone here eventually. But first question in the chat is, we've experienced some significant delays in getting COVID test results back. By the time we get the results back from students, about a week has passed, perpetuating the spread. Any insights on how this can be addressed?
It's all about capacity, and labs right now are slammed with the number of tests that they're doing, and so it really is dictated by their capacity in terms of how quickly they're able to turn those results around. I know we have, within District Health Department number 10, we have been exploring trying to even purchase some rapid test analyzers, and have not had much in the way of success or luck in being able to connect or make that happen. So, we've tried to do some things to see if we can maybe provide that service a little quicker, but we have not been that successful with it. You're correct. When it's taking a week to get test results back, by the time those results come back for someone, it may be at the end of their isolation period, and by then they may have had contact with a whole bunch of other folks that inevitably, some of those are going to end up becoming positive. So, I can tell you that the turnaround time for testing is an issue that is brought up all the time on health officer phone calls, in terms of looking at how can we improve this. And to this point, nobody's been able to identify what that secret is.
Okay, next question. Do you have access to the Abbott Binax Now antigen test that could be supplied to community mental health to assist with testing in adult foster care homes?
We actually did get some of those testing cards in, and we will actually be having some of our staff going through a training associated with those on the 30th of this month. And so once that's completed, we'll be able to kind of share those out and begin to utilize those. Our supply, I believe, just came in yesterday or maybe on Friday. So we really haven't had a chance to do much of it other than to look at trying to get a testing set up. But it is something that we're looking at, in the event where we need to do a rapid test someplace, whether it be the courts or another work site or, a long-term care type facility or something along those lines, even in the schools if need be. So, once we can get trained on using those and kind of put our plan in place, we'll be rolling them out. The problem is going to be in talking with the state. They have a finite supply of those, and they're not sure if they're going to be getting any more in. So it could be one of those things that, yeah, we're going to start doing this, and then all of a sudden it's going to end because we've used them up and we may not get any additional ones. So we're trying to find some clarification out on that as to, are the supplies going to be, going to continue to be available or not. So more to come on that as we kind of move our plan forward.
Okay, there are no other questions in the chat box. So anybody on the phone who would like to unmute and ask a question? All right, that might be it, Kevin.
Nothing else for today, guys. Okay, Brett, anything else that you'd like to share?
I don't think so. I'm all set.
Okay, Jordan, anything else from data or numbers?
Nope, I think I'm set.
Okay, then that's really all that I have to share today. Thank you guys for taking time to get on the phone. We will continue to be involved in moving COVID vaccination forward in terms of the planning for that. And so as more information becomes available on that, we'll continue to share that with this group so that you guys are aware of what's going on. Our plan right now is that we have these calls set up on a weekly basis. And so we will try to talk again next week, Tuesday, for those that are able to make it or are interested in being able to make it. If between now and then there's something that we feel we need to share with you, then we may look at bringing the group back together again to have a quick call, or we'll do it via email. If you guys have any questions or concerns, by all means, reach out to us. Most of you probably have my email address, or I know you have Brett's email address, so don't hesitate to reach out to us. If there's some data that you would like to see included in these updates, let us know, and we'll see if we can, put that, include that data in here, so that we're giving you as complete a picture as possible. And other than that, one final ask, if there's any questions out there. Okay, if not, then again, thank you for taking time to hop on this call with us today. And everybody have a good weekend, stay safe, and we will talk with you again next Tuesday. Thank you, guys.
Thank you. Thank you.